All right. Good afternoon. Good morning to everyone. Thank you all so much for joining us at the Hep B TV Summit today. My name is Catherine Freeland, and I'm the Public Health Program Director at the Hepatitis B Foundation, and I'm excited to be with you today moderating this session entitled Local Innovations on Hepatitis B and TB Prevention Efforts. I'm joined by a really amazing panel who will be highlighting best practices and lessons learned around community engagement, education, outreach, and improvement for hepatitis B and TB outreach. I hope some of the presenters will help inspire your community outreach on the ground in your local areas. As we walk through our panel today, please be sure to type your questions or comments in the question and chat box. I will be monitoring those and take us through question and answers after the panelists do their presentations. At this time, I'd like to briefly introduce our speakers for this session. First up, we have Becky Nguyen. She's the Executive Director for the Vietnamese American Cancer Foundation. She'll be followed by Chen Chi Wang, who's the Executive Director and founder of the Asian Women for Health. And finally, Jaime Carrillo is the Planning and Strategy Consultant at Champions for Health. I'd like to welcome and thank each of our panelists for being here with us today, and I'd like to turn it over to Becky to start. Welcome, Becky.
Good morning, good afternoon. My name is Becky. First off, thank you so much to Catherine and her team for coordinating this event. This is my first time, so bear with me, okay? A little bit about our organization, the Vietnamese American Cancer Foundation. We are in Southern California. We were founded by a group of cancer survivors and local physicians who saw there was a need to address cancer rates, particularly the mortality rate in the community. So we are dedicated to preventing cancer, improving patient quality life, and saving lives through cancer education, research, advocacy, and services. Kate, would you, yes, forward, yes, one more for me, please. And so our community profile consists of majority, about 70% foreign-born. Most of our seniors, about 90%, are limited English proficient. And 39% are linguistic isolated. And along that line, about 55% are limited English proficient in general in the population. As far as educational attainment, we are the second lowest in that arena, about 73% having high school or above, whereas comparing to the general Orange County population, it's about 83. So we're trying to still catch up about that. The total population in the community in Orange County is about 36% with the bachelor's, whereas with the Vietnamese, it's about 28%. Next. So as far as cancer disparities, our top cancers are lung, liver, stomach, colorectal, pancreas for male, and breast for female, whereas in the general, as you could see there, it's a little different from our population, our community. And liver cancer is really tied very closely to hepatitis B. And as you could see, and so why are we addressing the hepatitis B? Next, please. For VSCF, we provided the community level of hepatitis B and also C, as we wanted to address that as well. We do a lot of the outreach and education, patient navigation, screenings where we could do it, and care coordination. Our outreach and education consists of weekly radio show. In the past, it was in-person workshop, monthly workshop, and then face-to-face during the health fairs, community events, and all of that. Patient navigation, again, is very crucial in our community, although many people would say that in the community, you have a lot of Vietnamese physicians already, so why would you still need this? Many of the physicians may not have the time to provide the detail or the information in a layman term as our community would need. So patients continue to be very important in our community. Screenings, We are in the ground at all sorts of events, from health fairs to community events, to do the screenings. And I will share with you the newer ways that we have adapted during the pandemic in that way. Care coordination is very detailed, individualized, providing care for the needs of each of the individual for the community. So next. So before COVID-19, we do community events, health fairs, educational radio and TV shows, community seminars, workshop, monthly meetings, where we would go out into the community where they live, worked, shop, pray, and socialize. Really out there, hands to hand, face to face. But as you all know, during the pandemic, we have no choice but to be more isolated in that respect. However, our work continues. And so with the challenge, next please, with the COVID-19 challenges, we cannot do what we typically do, as I have mentioned to you. So how did we do that? We became creative. Next. We get innovative. And we go virtual and online. We go to vaccine events. We conduct drive-through clinics. And as you could see the next few pictures, that how we actually do it. For example, in this picture, we have the vaccination event. Along the way, we also have the hepatitis B and C screening. Later on, we also added the TB as well. So all of this is done through the coordination on the phone, online with our wonderful staff. And as you could see, we adhere to all the social distancing and also the COVID safety guidelines. Next. So as you could see here, we talk, educate them, fill out forms so that they could get their blood test at the clinic. Our staff take that opportunity, especially during the 15 minutes wait during the COVID vaccination event, to educate the community more about TB and hepatitis B and the importance of getting vaccinated. Next. As you can see where we circle there, this is inside a church parish school gymnasium. You could see the people are lining up to get inside to get vaccinated. Beside the hug between the mom and the child, as you could see, the child's nervous in getting the vaccination, so the mom was hugging her. But behind that is a table where our lab partner would draw the blood to test for hepatitis B and C. Next. So what did we learn? We learned to be patient. We learned to be flexible. We learned to be creative and continue our empathy, to stay engaged and to stay connected with our community, so we could continue providing that education and still go where they are, but it's in a different venue in that respect, to encourage screening and providing them the education as needed in that way. So that's the basic of what we learned, and I thank you for the time.
Thank you so much, Becky, for that very informative presentation. I'd now like to invite Chin-Chi to share her presentation. I think you're unmuted, Chin-Chi.
My apology. Hello, everyone. My name is Chin-Chi Huang. I'm an immigrant from Taiwan and a breast cancer survivor turned patient advocate. Currently, I'm the executive director of Asian Women for Health, and I started the nonprofit organization in 2012 because as an immigrant, I realized how difficult it is for Asian women to navigate the U.S. healthcare system. And today, I just wanted to spend a few minutes to go over about a new initiative that we're doing. It's called Educations. We received a seed grant from the National Hep B Foundation, and we are using ESL as a platform to improve health literacy and also vaccination confidence. Next slide, please. So, as I mentioned, we know that ESL is a really good and effective way to improve the health literacies, and also to, while the students have the drive and desire to learn English, and this also provide a natural setting for them to learn and improve their knowledge about different health diseases in a non-stigmatized way. And we found that very, very effective, especially during the pandemic era. Many of the ESL providers have advanced to resorted to using remote learning as a way to conduct the ESL lessons. So these are just some of the research studies that we show that ESL is a really effective way, an innovative way to help improve the health literacies of immigrants and refugees. Next slide, please. So with this grant, we were able to build a coalition, and we have the Mass General Hospital as the healthcare providers, and we are working with Tufts University, who were acting as our academic partners to create surveys and to get feedback from our ESL providers, which consists of different Asian serving agencies and also housing projects that they have large Asian populations. And I'm happy to report that to this day, we were able to expand our ESL provider partners from 6 to 10 providers, and we're expanding beyond the Greater Boston area. Next slide, please. So this is just a glance of our project timeline. So for the first 3 months, we spent time to work with the partners to decide what would be our shared goals. And also we have invited our academic partners and health providers to give presentation on health disparities, and also give presentation on hepatitis B. So we can familiar ourselves with the topics, and also with we are learning from the providers what's the needs of their students. And then for the next 3 months, we're working with our academic partners to develop the Hep B lesson plan, and we are going back and forth to send the draft to the providers and have them to give us feedback. And we learned that in order to meet their students' need, we have to adjust the content and make it for different levels, like the beginners versus the intermediate versus advanced level. And then for the final 3 months, we were able to pilot the Hep B lesson plan. And one of the feedback that they gave us is that, their students also wanted to learn more information about COVID vaccinations. So as a result of their request, we also developed a lesson plan focusing on COVID vaccination. And we were able to get their feedback, and also to provide linkage and resources to different information about COVID, and also Hep B providers, screening providers. So our next step is that we not only created Hep B lesson plan, we are expanding, and we created other lesson plan, including, like I said, COVID vaccination, dementia. We also added breast health, cervical health, and also diabetes lesson plan. So all of these are in the process being finalized, and we're adding additional resources. And we are also hoping to frame this as a community service learning opportunity for college students, and also employees resource group. And we will frame the position it as a way that they can provide, they can perform community learning service project in a risk-free, contact-free environment, so they can be trained and volunteer as a ESL instructors. Next slide, please. So far, we are successfully piloting with three ESL providers, and we have reached over 200 students with 10 different classes. And we have really positive feedbacks from students, and they were able to ask questions and even beyond the topic that we intended them to learn. And one of the ESL providers even said that this project, excuse me, this project had led her to start a conversation with her own mother regarding their family's Hep B and liver cancer history. So, I just wanted to thank you again for giving me this opportunity to tell you about our initiative, and I will be happy to answer any question you have. And if you like to, work with us, and be happy to share the information with you.
Wonderful. Thank you so much, Chin-Chi. Now we'll turn it over to Jaime.
Thank you, Chin-Chi. Thank you, Catherine. My name is Jaime Carrillo, and I'm the Planning and Strategy Consultant for Champions for Health, which is the foundation arm of the San Diego County Medical Society. And it's our mission to improve community health and wellness, access to care for all, and support for physicians through engaged volunteerism. And CARE-TB stands for the Collaboration for Action to Achieve Results Toward the Elimination of TB in the San Diego County Filipino and Vietnamese communities. Next slide, please. CARE-TB is a collaboration of three agencies: Champions for Health as a lead organization, the San Diego County Tuberculosis Control and Refugee Health Branch, and the California Department of Public Health, TB Free California. We are a public-private partnership and received a mini grant from the TB Elimination Alliance for a one-year project to create a TB communication and marketing plan focusing on San Diego Filipino and Vietnamese communities. Because we're a cross-border region, we have a high incidence of TB among three main populations. One are folks that are Mexican migrants crossing the border, and our two second highest populations are Filipino and Vietnamese individuals in the community. And because of our cross-border relationship, and I think as we've seen through COVID, there's been a need to reach out to different language groups at a higher rate because of COVID, and we've seen a lot of gaps in care. And so this was an opportunity for us to lean in. As was mentioned by some of our other panelists, we do a variety of other preventive and specialty health care initiatives to provide the uninsured access to care. This includes community-based health strategies. In the past, we have focused on flu. We have focused on preventive screenings for heart disease and diabetes. But tuberculosis is something that has been new for our agency. So it's been very exciting to lean into other disease states the way that others are leaning into additional chronic disease states in the community. In community-based settings, I guess, particularly to make sure that everybody we're trying to reach is reached. Next slide, please. Our funding occurred from October of 2020 to September of 2021. So we just closed out our project year. And our goal was to create culturally and linguistically appropriate prevention messages. One of the cores of our program has been our CARE-TB Advisory Committee, which is a new committee that has occurred here in San Diego County. And this work is being incorporated into the San Diego County Tuberculosis Elimination Plan under the supervision of the Tuberculosis Elimination Committee. And one of the really exciting outcomes of this effort has actually been systems level change with our county in terms of really having the County Board of Supervisors get behind a plan to expand and include the elimination of TB and LTBI as part of the larger chronic disease strategy here in our county. Next slide, please. Our committee structure is composed of a communications and outreach committee, of which CARE TB sits in the middle of. And our co-chairs are Marty Brentnall from the County of San Diego and Champions for Health's Director of Community Health, Andrew Gonzalez. We also have committees composed of schools, which are really important here in our cross-border regions. And then we also have a community of practice that is advised by the County of San Diego, University of California, San Diego, Vista Community Clinic, and Family Health Centers, which are two of our largest regional federally qualified health center partners. And then our schools committees are also consulted by the Healthy Campus Consultants and by staff from the Mesa College. All of these folks are part of the Joint TB Advisory Task Force, who are led by Dr. Anita Kadakia from the County of San Diego and Dr. Jeanette Alzis from San Ysidro Health, who is also one of our primary federally qualified health centers here in the border region. Next slide, please. Our approach has been to work with a variety of entities. One of the unique ways that we have come in to be a partner in this effort is because of Andrew and the organization's vast outreach to community-based organizations with our prior work. And through this strategy and through the county's existing relationships, we've been able to include representatives from over 30 entities, including 35 non-county participants. And this ranges from community health, community-based organizations, community health centers, to learning organizations, and workforce partner organizations also across the spectrum. So we're not just reaching the individuals that we're reaching. I think one of our innovations is also letting young people know in these communities that there are efforts out there that they maybe could be attaching onto in terms of health careers and serving their communities differently. And so that's also been a great ancillary byproduct of our work here. Next slide, please. As mentioned earlier, I think some of the most important partners in our advisory committee are the community-based organizations that support us on a regular basis. And these include Bayside Community Center, the TB Control and Refugee Health Branch at the County of San Diego, as well as CARE TB, TB Free California, Samahan Health Center, which is one of our federally qualified health centers that specifically works with the AAPI community, specifically Filipino, the San Diego Unified School District, and then participation from our cross-county collaborators at Yuba and Sutter County Public Health. Next slide. Our project is staffed by committee consultants. We have a small but mighty and lean team. We're not a large public health organization, but we're able to leverage the resources that we have as a small organization and our medical volunteer staff to support our needs on the ground. This has allowed us to complete a community and provider needs assessment, to engage in virtual and in-person focus groups as well with our target community, to have these as moments to review TB prevention messaging, and also to distribute updated materials to partners on LTBI and TB. Next slide, please. Some of the things that we have accomplished through this model, and I must say that I'll get to COVID and our lessons learned, but COVID has been an opportunity for us to innovate. I think at first it was very scary in terms of figuring out how it was we were going to carry out our project activities and the challenges that came along with that. However, we learned that our community is hungry to protect itself and to be on top of their health. We as community-based organizations and partners just need to meet them where they are, to provide them the right information in the right language with the right community context, so that they can be supported in being champions of their own health. And And through this process, we were able to administer 183 community needs assessment surveys in Filipino and Vietnamese communities and analyze these data. We administered 26 provider needs assessment surveys as well. We conducted 5 Vietnamese and Filipino focus groups with some of our partners and collected 35 surveys through that. Here in San Diego, we also have a great, in our organization, we have a great relationship with our local paper, the San Diego Union Tribune. And on World TB Day, we're able to live stream a presentation led by Dr. Kadakia and our project coordinator, May Gutierrez, that engaged over 1,100 individuals virtually. Both in the live stream and also through Facebook. And we actually continue to see those numbers go up every time we check them, which is exciting. We've had 3 meetings of our TBEI advisory committee and have maintained an average of around 12 participants, if not stronger, which to us is very exciting in this time because everybody's busy with a lot of things. But our community partners, I think, see the importance of TB across the spectrum intergenerationally. So we've been able to reach out to quite a few folks through this effort. Next slide, please. Next slide, please. I'm sorry, can you hear me okay? As we get to the next slide, what they represent are some of the community-based events that we have had. We've been able to pair the activities that we're doing with mobile COVID vaccination sites. And so here in this image, we paired our community needs assessment process with the Mira Mesa Senior Center. And Mira Mesa here in San Diego is a community that predominantly houses and serves the Filipinx community. And so we were really excited. We met a lot of seniors that were happy to engage in our discussion. And we also had focus groups with Vietnamese Community Center. And also, as you can see, we're doing as much as possible to observe social distancing. Next slide, please. Our last slide is about lessons learned. And I think some of the lessons that we learned about this initiative is that sometimes community impact, having a community impact model with these disease states is really important. We often do work in silos, and I think this COVID pandemic and also the way that we've had to lean into each other has really taught us that we need different kind of backbone support and that we need to be a different kind of backbone support agency to our local organizations. And the coordination that entails is challenging. It's been exciting to lean into it, and it's been really though a cycle of innovation for us through COVID and trying to see how it is that we can maintain the momentum of not only community members but others to be really engaged in how we can best serve our communities and not have this be a flash in the pan moment, but a really transformational opportunity in how we can serve our diverse communities that are often more and more intermingling. That's another thing that we found here in our community is that, we encountered some folks that were Vietnamese and also spoke other languages. And so, that is present in our communities as well. Our partners have been essential, and language capacity and humility among our partner staff and among our staff have been paramount to success. And we owe it to our volunteers and our community-based partners that they have this capability and can provide us the community-based strength to do that. It's been difficult to reach out to federally qualified health centers because of they're at the front line of all health. And that's just difficult, but we've also had great partners, and we really appreciate them for coming through for us. We also had some interesting dynamics with incentives in terms of how the community responds to them and how those look like virtually as well. Information sharing became very different. And then we had some folks who were not willing to receive an incentive because we were reaching out via email. They didn't trust where it was coming from. And then we all know the physical challenges of coordinating during the pandemic, managing community-based events, and making sure that people are either vaccinated or masking or have policies to do so has also been something that we've contended with. And thank you so much for your time. We really appreciate being part of this panel, and it's interesting how sometimes just going back to the old school is innovation, but that's a little bit what it's felt like for us. Is getting back into community has been one of the most exciting parts of this process. As we know, many of us on this call, 90% of health exists outside of the exam room. And so this has been an amazing opportunity to see how that comes into play in actuality. And thank you for all your time.
Amazing. Thanks to each of you for excellent presentations, and I hope that others found it as interesting as I did. I know we had a lot of action going on in the chat box, and I see that some of you were able to respond to some questions that came up. But I do have some questions, and I hope that others will continue to type in questions and comments in the chat box as we move through our discussion section. The first question I'd like to direct to Becky. Did you encounter any sort of challenges transitioning some of your outreach activities online, particularly during the pandemic? And I wonder if others can maybe speak to this. And how did you overcome some of those challenges that you may have experienced, especially access to virtual spaces, access to internet, that sort of thing, if you could speak to that?
Oh, yes. Our community and the target population are those that are needed additional help, are not very savvy with tech, and I thought I was bad. But our staff had to take a lot of time, go through it step by step, and even before they could join the webinars, our staff having to do a dry run for them, educating them in language, and literally having to know where it is, the buttons on their phones or their their iPads in order to punch in step by step. So it did take a lot of time from our staff and the patients. And I must tell you, our team is crazily patient because just to a mere fact of having to, going step 1 to step 2, it was hard. And so, yes. But then as more of our community members were able to participate with the webinars, they were able to use that knowledge of how to use Zoom and join in other conversation, and sometimes even meeting with their own doctors about that. And using the Zoom. And, as soon as you hear Zoom now, they're like, oh, I know what that is. And so it's very exciting to hear that. But yes, there were a lot of challenges. It took a lot of time on the phone, and things that we typically do in a group space, we're having to do it individually. And so the time just multiplied in that respect.
Yeah, thank you. Jaime or Chinchi, any comments on that if you've encountered that?
One of the things that we tried to be proactive about, especially on the onset of the pandemic, as we were rolling out our program, was to try to be as paper-free and tech-forward as possible. So we created QR codes, and we had things available and on SurveyMonkey. And again, the most surveys that we got were paper-based and required that attention from somebody with a mask a few feet away, going through the paper survey, answering questions, being available, and really, continuing to curate that experience. And I agree, meeting virtually is a difficult thing for our community members. Everything from lack of access to technology to lack of a stable internet source. That's been the same with some partners as well, not just with some of our smaller partners, not just with the individuals that we serve. But all of these technical capacities come into play.
Thank you. Chin-Chi, anything to add to that?
Pretty much the same. I would say that, yeah, we also encountered the digital divide and, internet access, and also people, especially the older generation, don't feel comfortable using technology. So, we mostly resort to virtual events to continue our outreach education, but we also think it's important for us to continue to engage with the community however we can, because people are longing for the connection, and not feeling isolated is a big help during the pandemic. So we've been doing 3 free virtual event every month, and we just selectively participate in person outreach events. Yeah.
Yeah, thank you. And I saw this interesting conversation, Chin-Chi, between you and one of our colleagues as well about the ESL and how that got started, and if you'd be interested and willing to share your curriculum with others, or could give tips on how others might be able to incorporate the ESL platforms within their direct outreach.
Yeah, so one of the interesting feedback that we got from the provider is that, maybe because right now most of people are resorting to online learning. So it's possible that we can record the content in advance so the students can learn at their own pace. And then we can save the class time for, answering questions or have discussion. So that's one feedback that we got. And then the other thing is that, we can always find ways to get around, like make the virtual teaching more interactive and more engaging. So recently we did a social event. We call it the game night, and we make game using Taboo or I forgot bingo, and we're make it fun for people to test people's knowledge about different health topics and prevention, and yeah. So there are different ways that we can make learning more interactive and fun.
Thank you. And Jaime, you mentioned just getting started with the TB outreach. Do you have any suggestions for others that might be in similar situations to you in terms of communities that they're reaching and how they might be able to incorporate TB within their outreach?
Absolutely. One of the things that was mentioned, I think, also in the chat is the quote unquote innovation of using when patients are sitting, waiting for their COVID test results. They're just sitting there waiting. And so I think with any sort of health message at any time, we should be following that model as people are getting tested for COVID, because it's a population that there. And of course, we've in many of our communities reached a certain threshold. Something tells me folks that might not be getting tested for LTBI or for TB might also be those folks that are hesitant, and that still require outreach. And so I think continuing to focus on those folks is going to be very important. And I would say just the other thing is lean in. Sometimes we don't think that all health topics are our health topic, and it may not be our onus to own everything about it, but I think it is our onus to be a hub and a spoke for this information when we're community partners, and to find ways to share that load. And I say that because we have amazing partners that have allowed us to do that in order to lean in this way. And we are also recognizing that this needs to happen across a variety of disease states, and that there's a learning here about how to do some of these things correctly. When we were getting into the pandemic, our organization was leaning into what we called FluFit. We were going to have this dynamic innovation about doing flu and fecal immunotesting at community-based organizations, and then we were going to add glaucoma screening, and it was going to be all this thing, and now we can't touch people. And so it's like, but that still exists, right? And then we have all these other latent health needs that have perhaps not been at the forefront of people's mind. And so we need to use every opportunity, I think, that we have to lean into these healthcare moments and perhaps be prepared with, as the conversation comes up, oh, TB has caused me kidney disease, or I'm also dealing with diabetic retinopathy, and it doesn't allow me to read things the right way. All of these health conditions coexist within the person. They need to coexist within us as well.
Yeah, that's a really great point. Thank you, Jaime. Thinking about wraparound services, I think, is really important. And Becky, speaking of wraparound services and meeting the community where they are, you mentioned going to really wherever the community is, social places, religious places, to provide testing for hepatitis B. When you're testing in the community, are you doing other services as well for outreach, or are you also testing by risk, or is anybody who's attending the event able to get tested for whatever you guys are offering that day? How do you navigate that?
We just recently started to resume the health fairs, but in a more, I guess, smaller type of event. So at these events, we have the TB, we have the hepatitis, and then just recently we have the COVID testing and COVID vaccine, and then there will be physicians who are available to ask for our community members to ask the questions about health. And so we do the general vital signs and things like that for our community. But I think what it is so important is we talk with them. We do have like a survey just to keep check as far as their risk factors. Where have they been tested, and all that before offering the testings for them.
Great. Thank you. And Jaime, your list of advisory members and task force members was really impressive. Can you talk a little bit about how you were able to get buy-in and get people to come to your table and figure out strategically how you're going to address TB? And I hope that others might be able to think about that, because I know, Chinchi, you had a really impressive list of partners working on your ESL project too. If you guys could speak to buy-in and leveraging resources in your communities to really make a big difference.
I'll have to say that in some ways we lucked out because these are networks that we've been building over the past 8 years with flu and with blood pressure screenings and with other states. We've also had when you have the county as a partner, people want to participate. I'll be honest, their ears perk up and they see the possibilities, and that's I can't discount the power of our partners in that. The rest has really been just being present and showing up, honestly. And that has taken years. And with our new partners, it's taken, there's folks that we've reached out to a few times, and then it has taken another partner for them to be introduced to us in order to build that trust in that relationship. Then we also, in terms of capacity, we were lucky enough to have our program coordinator have this be part of her task as well, to do that follow-up and that coordination, which is so important. I think sometimes we think that relationships just happen on their own. It's about an email or it's about a phone call. But right relation requires a lot. It requires follow-up and consistency. And with lack of capacity, I think these are some of the things that kind of fall through the wayside. And so we've also been just really lucky to have patient partners, especially among our core collaborative team as well, because I think they help to speak to these challenges and to connect us to folks despite those.
Great advice. Thank you, Jaime. And Chinchi, you had an amazing list of partners helping you with ESL. Can you speak to how you were able to get them to continue to work and invest in your ESL initiative?
Mm-hmm. I think that, all of our partners really value this co-learning, co-creating space, so when we come together once a month, we prepare the agenda ahead of time. We have different topic. We always building some kind of capacity building activity or have presentation from the provider. So people are not just there, being talked to, but, they have the opportunity to give feedback and to learn. And also, this is a very interesting and I would say the innovative thinking, because the ESO providers are not the usual, partner when you're thinking about a health coalition. So at one of our meetings, we actually brought in a speaker from the Hep C Prevention Coalition in Massachusetts, have him talk about, how their coalition work and to see if we can, work with them because, we don't want to reinvent the wheel. So, so I think that just be sensitive about your partner's, situation. We don't want it to create additional workload for them. And if there's something that they can integrate, we can help them to better integrate the ESL health curriculum into their regular programming. That's better for everyone. And that's why we are also looking outward to try to recruit additional volunteers to teach this curriculum, because sometimes they say that, certain topic, like if it's breast health, cervical health, their instructor may not feel comfortable, teaching or talking about that topic. So then we are trying to broaden the talent pool and to, improve the community corporate or community campus linkage, so we can create like a win-win-win situation that, the community will get to learn more about different health topics, and then the students and then the corporate employees get to perform community service, and then we get to disseminate health information in a safe and trusted environment. So that's why I think ESO health curriculum is brilliant.
Yeah, no, definitely. I appreciate that because everybody has something that they want to bring to the table, and it's just a matter of figuring out and navigating that puzzle of what can everybody bring to the table that it's mutually beneficial for everybody. Becky, anything to add to that?
In addition to that, as we're trying to respond to the needs of the community, and believe it or not, we do disseminate information, and then we do get calls through our drive-through food distribution. And so it's just that having to figure it out, what is the need of the community, and health is in so many ways we're having to be innovative to reach the community. And so during the pandemic time, we found there is a need to address loneliness and mental health, and there's a food scarce. And so we started the food distribution, and that was our route to stay connected. And the community member continued to call in, and then we, again, link them over to webinars and whatever else that they may be interested in. And so it's just a matter of being flexible. That's the bottom line.
Yeah, no, I think that's so important. And I think sometimes we get focused sometimes on our objectives, but I think, the community partners can't necessarily focus on the health when their basic needs like food is not being met. And so I think, your point exactly, talking to the community, figuring out what their needs are is the top priority. And then you can kind of squeeze in the health messaging as you build their trust and as you have those relationships develop over time. But yeah, I think that's such an important point. Thank you so much, Becky, for bringing that up. Any last comments from our panelists? I know we're running a little bit over time, but I wanted to give an opportunity for you guys to share your last words of wisdom on the panel today.
I'll go first. I think it's just to be present, to listen to the community, and whatever holes there are. Let's see if we could just kind of find a way to plug in that hole. And so, in that, from whatever the needs, health is so. Overall whole you're talking about the whole self, and so it's really it's just what is your need. That's the question that we needed to ask our community, is what is your need, instead of us telling them this is your need. It's the other way around.
Yeah, that's so important. Thank you, Becky. Jaime or Chinchi, any last words of wisdom?
Yeah, I would say that, collaboration is key, try to, work with other agencies, and so we can uplift each other, and so we can, like you said that Ling Ying, Jamie say Ling Ying, right? So we can fill the gap.
And I would say that, as I think, we just need to continue to collectively lean into health. Health is a collective responsibility. We're seeing more and more. There's the part that we do individually, but there's also the parts that the systems and us as civic actors and other folks in between that we play. And I think the other thing, as we're speaking, is just the importance of engaging youth in this conversation. I think that was something I didn't get into very much, and we could probably get into on a whole different session. But it's the power of youth and engaging their families in this conversation as well. Still, that's still, I think, paramount in something that we saw in our outreach and our engagement. And we also know that youth continue to be, our youth will become the elders that are going to be at risk at later dates. And we also have porous borders now and porous travel and different kind of relationships when it comes to youth and traveling back to home country. And so we see different levels of exposure there to elders and to others. And so I just like intergenerational strategies for these disease states that we know are not going to go away need to also be, I think, front and center to our work. And building that workforce, right? So that having those folks, it would be nice to not need a translator, because the person on the other side is trained, capacitated, and paid for that knowledge and language access. And that's the future workforce I look forward to and hope we can build.
Oh, that's great. Thank you guys so much. This was an amazing panel. Thank you, Jaime, Chinchi, and Becky, for your excellent presentations and sharing your work and your knowledge and experience with everybody. We have a lot of positive hand claps and chats going in the chat box. I hope you guys can see that. But I'd like at this time to conclude this session. I invite you all, if you have further questions or want to chat more with any of our panelists today, to just reach out to them. You can use this great platform to do that. But thanks to our panelists and thanks to our audience for being here.